Mayor Eric Adams vowed Wednesday not to bring back an indoor mask mandate for New York City, a day after his public health department determined the 5 boroughs had reached high risk of transmission. Adams said he chose not to impose a face covering requirement despite the color-coded COVID-19 alert system he introduced in March, which says the city should now require face masks in all indoor public spaces. As deaths and hospitalizations persist are low and residents have improved access to testing kits and medicines for the virus at home, I'm proud of what we're doing, how we're not allowing COVID to trick us. We're staying prepared and not panicking, he told reporters Wednesday morning during a question-and-answer session at City Hall. When I look at hospital admissions and deaths, the numbers are stable. We have all these tools that we didn't have when we first set up the color-coded system, he added, citing the city's distribution of free antiviral coronavirus pills, which began in January, and testing kits for home that the town hall began to give away in December. The city has seen a surge in cases in recent months amid the spread of the highly contagious Omicron subvariant BA.2, from an average positivity rate of 1% for 7 days in early March to over 8.8% on Sunday, city figures said health department. But while cases rose, COVID deaths and hospital admissions remained relatively low. The city reported a 7-day average of 50 new COVID-19 hospitalizations on April 15 and 5-6 on May 15, as coronavirus deaths remained at about 5 a day during that period. Adams predicted Wednesday that variations will continue to come as part of a new normalization in the United States and Big Apple, arguing that the city can't enact new regulations with every wave. If we have thoughts of shutting down, panic, with every variant that comes up, we're not going to function as a city, he said. I feel like we're being extremely strategic and fighting COVID, not only with the tools we didn't have before, but we're also fighting COVID with the intelligence we need to win in a COVID environment. City data shows that 78.3% of New Yorkers of all ages are fully vaccinated against COVID-19 and that 87.9% of adults have received at least 2 shots, vaccination rates that have remained largely unchanged in recent weeks. Just over 87% of city residents of all ages have received at least 1 vaccination, according to City Health Department statistics, while only 38% have received a booster shot. As deaths and hospitalizations have declined recently, elected city and state officials have lifted several coronavirus-related regulations, including the immunization card program for indoor venues, mask requirements for students old enough to get their shots, and the state office's mask requirement.